our work is bringing health and hope to the world. And we accomplish that by bridging the gap between surplus here in the United States and the need in communities all over the world. The kind of supplies that we're shipping, they just don't have, and if they do have it, they'll reuse it in perhaps an inappropriate way. So they will reuse surgical gloves over and over and over again. They'll wash them, they'll hang them on a clothesline outside in a non-sterile area, and then the surgeons will put them on again if they have them, and they'll wear them until they break. And then once they rip and tear, they'll cut the fingers off, and then they'll use those for drainage tubes for post-op care. You have to be very, very innovative in a country where you don't have even the basics. Up on the wall behind us here are flags of most of the 80 countries that MedShare has shipped to over the past 10.5 years or so. These are forgotten countries. These are countries that, most people in the U.S. are not traveling to on vacation. And so what we do is we set up green recycling barrels. Then what we do is we ask the caregivers and the medical professionals, when the case is finished, to take any supplies that weren't used and put them into our green recycling barrel. And these are supplies that never came in contact with a patient. They're not contaminated, they're not blood-borne pathogens on them. It's perfect supplies that are clean and sterile. But through laws here in the U.S., they're not allowed to reuse those supplies out of kits. So we're capturing little things. We're capturing a syringe, we're capturing one piece of 4x4 gauze, we're capturing an irrigation bulb, little tiny things. But then when we amass them together and aggregate them together and bring them into our distribution facility, we have tons. And when we have tons of supplies, we have healthcare solutions for impoverished people.
When you're just one hospital, it seems like what you're doing, it may be effective, but may be a little bit insignificant because you are just one hospital. And I think what MedShare has done is they have connected us all so that you can make more of a difference because you're working with other hospitals.
So here's an example of a spinal tray, and the medication inside expired, so we removed the medication and dispose of it properly. But then there's many items that are still left in here that are very usable. Povidone iodine, prep sticks, gauze, bandage, etc. And so that's what they will then take out at MedShare during their volunteer sessions, put into their inventory for others then to go in and order.
We've tried to set up, kind of a place people want to come back. And every volunteer that comes in, we explain the mission to them. So we explain what's the need in the world, to really tell the stories of where people are doing without and what happens when they have to do without these medical supplies. And then talk about what it is they're going to do to help that. How is their work going to make a difference? That was one of the things we think is important, that you don't just come in and pack a box of gauze or whatever, but you actually know why that's going to make a difference somewhere.
I worked in the food industry for 36.5 years. No medical experience at all other than a Band-Aid. I've really enjoyed what we're doing here. I think it's a win-win situation. We're keeping things out of landfill. We're helping many people over the world. It's a fun, rewarding place to be.
The entire team and all of our volunteers know the impact that we're having on the planet and the well-being of the planet and the people that populate it through our work. And we're very excited and very passionate to be able to do this. It's very, very special work. It's very heartwarming and life-changing work that we do, both here and around the world.